It's a beautiful day in the neighborhood. A beautiful day to ask a gay doc with Dr. Renzo Corzano of Desert Oasis Healthcare. Hey, how you doing, Renzo?
I'm good. Just tired.
I think everybody is.
Yeah, a lot of
It-
stuff going on.
yeah, it seems like this last month has felt like a year. Uh,
Like 3 years.
yeah, well, there's a lot going on, and a lot of it has to do with politics. I mean, we've got a new HHS secretary who
Hmm.
is in charge of basically what CDC, NIH, all of the initials that mean healthcare and health research. Robert F. Kennedy Jr. was sworn in, and he was voted in by all Republicans except the guy who was a polio survivor, Mitch McConnell.
McConnell. Yep.
And so now here we are, what, a week later, and we've got a serious measles epidemic. And that's happening where?
It started in West Texas. Okay. And as of yesterday, 58 cases, mostly children, 5 to 17. Um, Basically saying that about, 20% of the incoming like children to the school district, they're basically unvaccinated. Um, So surprisingly enough, out of the 58 cases, four of those cases were in vaccinated individuals.
Oh,
And yeah, and then 13 of those patients have gotten hospitalized. And then in the last couple of days, it's actually moved into New Mexico, where there's been 8 cases reported. And out of those eight, six of them were unvaccinated.
so a couple of questions here. First off, since that disease was, for all intents and purposes, eradicated among American, kids, what the hell is a measle? Because no one had a
Exactly.
measle when I was growing up. What are measles?
Exactly. So to your point, so the US actually declared measles eliminated in 2000.
Yeah.
Okay. And so because, there's been all this like anti-vaccine sentiment that got started basically by a fake paper that got published in the Lancet, there's been this huge like anti-vaccine movement. And the goal for measles is basically to have about 95% vaccination, okay, because that will create some kind of herd immunity. So what is measles? Measles is viral. Okay. It is super, super contagious. Check this out. 90% of people in close contact who are not immune will become infected. 90% of people
Wow.
not immune. And then check this other one. If you get one dose of the vaccine, it's 2 doses. Okay. After one dose, 93% effective. After 2 doses, 97. It's uncommon to get measles if you're fully vaccinated. However, we do have breakthrough infections, right? That happens regardless. And check this out. Breakthrough infections can occur, especially in communities experiencing outbreaks where high levels of measles is circulating.
Hmm.
So even in this population, in Texas and New Mexico and wherever this ends up, there's still going to be people who are vaccinated who are going to be getting this. And so the next question becomes, why do we care about measles? Because,
Yeah.
measles for the most part, it's basically high fevers, cough, runny nose, watery eyes, and this rash, right? Okay, so this is why we care about measles, okay? So complications of measles. We'll start with the common ones that are basically somewhat inconsequential in most healthy people, okay? So 10% of kids will get an ear infection. Big deal, right? 10% of people will get diarrhea. So if you're healthy and, whatever, you can put up with the diarrhea. But check this out. If you're pregnant and you get measles, premature birth can happen, low birth weights. If you're immunocompromised, like if you have, I don't know, leukemia, cancer, HIV, AIDS, anything that's immunosuppressing your system, then basically that's when the bad things happen. Okay. So you can also get like this secondary infection on top of having measles because it really weakens your immune system. Um, and then this stat was the one that actually kind of like really resonated with me. 1 in 5 people with measles will be hospitalized. When it comes to pneumonia, 1 out of every 20 children will actually get a pneumonia from measles. And this is actually the most common cause of death in children. It's actually pneumonia. You can also get like swelling of your brain, which is called encephalitis. And that happens in like 1 out of 1,000 people. And the scariest thing about measles, I think, is what can happen later after you get measles, something called subacute sclerosing panencephalitis, which is rare, but it's actually very fatal. And it's a disease of the central immune system, which can actually happen 7 to 10 years after you first get measles as a kid.
Wow.
So, yes. And then the other really bad thing about measles is you can get something called acute disseminated encephalomyelitis, which is called ADEM, which is a neurological disease. And this actually can happen during the recovery phase of your first like measles outbreak. And this carries 10 to 20% mortality.
Wow.
Okay. And if you survive that, then you basically can be left with like neurological deficits, which can include deafness, blindness, like just neurological, intellectual disability. So when we talk about measles, yes, the majority of people are not going to, have these like long-term effects, but measles is highly, highly contagious, and it does carry sometimes a high mortality risk. So this is why it's important, and this is why we should care about this. This is only happening because we are not vaccinating enough people.
Do these vaccinations lose their potency over a lifetime?
Sometimes, yes. And actually, it's funny that you bring that up because starting last year, I've been ordering basically like immunity status on my patients, and I'm including a measles, mump, and rubella titer. And I am seeing people who have waning immunity against measles. And so we just revaccinate them.
Wow.
So yeah, it can go one way or the other, right? You can have the immunity lasting for your whole life, or you can lose the immunity, and when we see that, we vaccinate people. But yeah, I mean, it is definitely possible. Like even if you were vaccinated as a child, I always, just draw a titer just to make sure.
What is a titer?
A titer is basically checking like the amount of immunity that you have in your body against something.
Now, for our audience, there are a lot of people of a certain age who have immunocompromising conditions, and we have a lot of folks who are HIV positive.
Exactly.
And so for adults, this could be an issue if this thing gets out of hand. We got West Texas, we got New Mexico, we've got 58 cases, and like you say, it's so contagious.
It's super contagious, man. This is another stat. Let me. This is the one that I thought, holy cow. Okay, look. So it's spread through coughing and sneezing, right? And check this out. People can get measles just being in a room where a person with measles has been, because he can stay in that area for up to 2 hours.
Wow.
Yeah.
What about other things that we were, vaccinated for as kids? Are those going to come back? Are we going to see polio back? Are we going to see rubella? Are we going to see whooping cough?
I hope not, honestly. But when we talk about, rubella, or mumps, things like that. So the vaccination for measles, which is the MMR, is actually a combination vaccine for measles, mumps, and rubella. And then in the younger population, they were getting vaccinated with MMR, and they added V for chickenpox, like the varicella.
Yeah.
So, but still, I mean, part of like the regular routine new patient panel has been to check titers just to make sure that people still have their immunities.
So we've learned a couple of things here. There may be waning immunity on your childhood vaccinations for, what is it, MMR?
MMR, yeah, measles, mumps, rubella.
Okay. And we've also learned that there's a test to check your immunity levels to such viral interlopers, and it's called a titer.
Yes.
Wow. Good stuff. If you have a question for Dr. Renzo Corzano, you can always send it to lgbtqhealth@mydohc.com. Ask a Gay Doc is a service of KGAY 106.5 and 92.1 and
Desert Oasis Healthcare, your health, your life, our passion.
Renzo, thanks for scaring the crap out of us again.
Well, John, I don't mean to, but I just want people to know that it is highly contagious.
Yep.
and that they should be vaccinated.
Yep. This is our reality right now, and we appreciate you keeping it real.
Yeah. Sorry.
You know, we had this show all edited up and we were ready to go, but then information changed. And right now, reporting live from his car is Dr. Renzo Corzano with an update on some measles facts.
So basically, if you were vaccinated before 1968, you should consider getting another vaccine. And also, if you were vaccinated between 1968 and 1989, you probably only got one vaccine, so you should probably consider getting a second one, okay?
So basically, we all need boosters.
Exactly. And the bottom line is it just will not hurt you at all if you actually get another vaccine for this, even if you have the immunity already there.
All right. Now, the outbreak totals have actually risen since we originally recorded this.
Yeah, so according to the CDC website, so far 164, and this is as of February 27th, and one death so far confirmed.
All right. Well, thanks for the update on the information. And it's just going to go on and on and on unless people get vaccinations, get boosters, and get smart.
Yeah.
Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGAY channel so you won't miss anything going on in the neighborhood. And you can always listen live to KGAYPalmSprings.com.